So as a first-year medical student, I was spending time at Open Door, volunteering and surrounding myself with the community. It started to slowly click in my head that we had a bunch of resources at the TTUHSC, and we had an entire population of people that could benefit from the resources. So when we presented the idea of the clinic to Open Door, they were very responsive to the idea. The one thing that we wanted to do is we just kept asking, what can we do to help? What can we do to serve? And the answer we kept getting was just be present, show up, make the community your community.
We meet here and basically we just provide free healthcare and free primary care to the people of Open Door. With homelessness and the patients that I've met, a lot of them are dealing with a lot of hurt, a lot of trauma in their past. Trust is probably a very scarce commodity in their lives.
I think sometimes when it comes to the doctor-patient relationship, it could get kind of jaded or broken up, right? But knowing that there's going to be people that they can feel that they can trust, they can reach out to, they can open up about their own personal journeys and experiences, that consistency for sure is going to be here.
We didn't want a space where we were having new medical students every week and where the community members had no idea who was providing the service, as if they were just going to the hospital and they didn't have any relationships with any of the caretakers and providers.
We see regulars come back, and they recognize me, sometimes there's a doctor, and so for me, I feel like it's a positive impact for them, knowing that we're going to be here for them. The impact that we're having on them, goes beyond, I think, just the medical needs, but I think to me it goes into their spiritual needs as well. And making sure that they know that there are going to be people here that are going to care for them.
We're not here to just provide medical services and write scripts. We're here to build a relationship, care about you as an individual, and as we care about you as an individual, take the next step and care about your medical care.
I want to be involved in something like this because, as I said earlier, service is very important to me, and I think that's it's an important way as a physician and healthcare provider to show Christ's love and service to the community, patient population, and the people around me. So really, no matter what happens, I want to make this a commitment and make places like Open Door Clinic a commitment.
I think from day one, the impact for me has been pretty profound, and it's really shaped me into a different person where I am now. I've never thought that I would ever claim to even kind of remotely have a ministry, but I feel like this truly is a ministry.
The experiences that we have had here at Clinic are ones that we're going to carry with us for the rest of our lives, and I think that they're definitely going to help us become better physicians.
My idea for the clinic wasn't for it to be the biggest thing. It was about having an intimate thing where individuals suffering from chronic homelessness and individuals with backgrounds from sex trafficking could come into an environment with integrity. They know that when they saw one of the medical students or whoever the provider is that day, they will be received with compassion, empathy, and love, and that they will have a place where they can get continuous care, receive prolonged care, and actually be encouraged. Man, it gets me excited, and I thank God for it.
I'm Dr. Felix Morales, and I love serving at the Open Door Clinic.
My name's Kyle Armstrong, and I love serving at Open Door Clinic.
If you're not smiling, I don't know what you do about it.